Your patients oftentimes won't remember what you did or even what you said, but they will remember how you made them feel. At our office, we do over $2 million in revenue a year while taking 8 to 10 weeks off, not because of our clinical mix, but because of our ability to communicate effectively. As dentists, oftentimes if we're given the choice on paying to go to a course to learn a skill such as how to do a more effective root canal or how to refine our crown prep protocol, that almost feels easier and feels better than, hey, how about you learn how to connect with people quickly and actually get them to buy into the services that you've spent so much time refining and developing so that they feel good about accepting the treatment in the first place. What I want to do now is go through some of the key strategies that we implement in our office in order to connect with people and communicate well so that I can actually get them to move forward with the skill set that I've developed to living healthier and more fulfilling lives. The first strategy that I like to implement in helping people increase their communication skills is to really just come down and boil it down to what are the main procedures that you're recommending in your office? Is it crowns? Is it root canals? Is it veneers? Is it Invisalign? Whatever it is, if you write down the key procedures that you're recommending to patients, you'll find that it's probably not as many as you think. Even if it's 10 to 15, which would probably be a lot for your office, writing all of those down just to get started is crucial in setting yourself up to develop the communication skills that you need in recommending these services. Once you've written down the core procedures that you recommend in your office, then it's time to write down, refine, and rehearse how you're going to present these things to your patients. I'll give you an example of one that I had to refine after many times of talking myself out of helping this patient with a procedure, and that is for crowns. So when it comes to recommending a crown, basically what I do is this. I take an intraoral photo, I pull it up on the screen, and I try to use an analogy. Sometimes I use the analogy of, hey, just like an old home has foundational issues that break down over time, in this tooth, you've had a large filling and it's starting to fail. It's starting to break down. Just like the foundation of an old home, things have to be reinforced. And what I want to do is reinforce this tooth now to avoid bigger problems down the road. I make it simple, I use an analogy that they connect with, and then I try to ask them, what are your thoughts or what questions do you have for me based off of my initial presentation? The second key strategy in developing a higher level of communication skills is actually taking the time to rehearse and role play with your team. In my practice, we take one afternoon a month and one full day per quarter to simply train, and the majority of what we train on is our communication skills. Just like the story of the two lumberjacks that are cutting down a tree, one stops periodically to sharpen his blade, the other one toils away all day, and the one that stopped to sharpen finished cutting down the tree significantly faster than the other one. In the same way, if you don't take time to train and rehearse with your team, then you're going to be training and rehearsing on live patients, which is going to result in less case acceptance and less good experiences on their first experience in your office. Coming up again with the core procedures that you recommend and talking to your team about how we want to present them and rehearsing with each other is going to provide them with a comfort level to feel confident in everything that they rehearse and recommend to your patients. The third strategy in communicating effectively to your patients is preparing stories and analogies that make it simpler for them to understand. The first one I like to prepare is stories. One example that I like to use is the patient that calls you the morning of Thanksgiving for a tooth that broke and they're going out of town on a trip to go visit family. When I recommend a procedure to somebody, when maybe they don't have any pain or discomfort yet, I like to use this story that oftentimes teeth tend to break at an inopportune time. Let me tell you about a patient that had a tooth break the morning of Thanksgiving when I was out of town visiting family and they were getting ready to leave for a big trip. There really wasn't much we could do for them at that point, and they had to suffer through that 4-day weekend, really not being able to even enjoy their meal. By doing this, you're making it emotional for the patient that by getting ahead of it now, I'm going to save you heartache down the road. These sorts of stories that you compile up as you practice are going to be vital to helping people feel like they are confident to move forward with the treatment you've recommended. The other part that's really effective in communicating to patients well is coming up with analogies, whether that's using examples such as, hey, just like when your tire treads run out, if you have an imbalance on one side versus the other, it's going to wear things out and make things out of balance. Or the foundation of a home, as it starts to break down and needs to be restored. Or one of the examples that I'll use is, hey, if you have your fork and there's food in between the fork, we can't clean out If we just try to wash the surface of it, we don't get in between each individual prong, we're not going to be cleaning things out properly, and you're going to be more likely to develop sickness and disease and progression of what we're seeing in your mouth already. Coming up with analogies that relate to your patient pool and being able to use them when they come up is going to be critical. And if you don't rehearse those analogies now, it's going to be hard to implement them when you're seeing the patients live on their day of their appointment. The final step in developing high level of communication with your patients is to make a list of the most common objections. If you write down what typically stands in the way of what you recommend to patients and why they don't move forward, you oftentimes find that it's not that many. Oftentimes that's a lot of money. I don't have that right now. I need to talk to my spouse. I need to think about it. Whatever the response is, if you haven't thought about this beforehand, you're not going to be able to help them move forward with the treatment that they're needing, and they're going to fall through the cracks and potentially develop further progressed disease, and it's going to be harder for you to treat them. So coming up with a list of common objections and your responses to them, and you rehearsing them, your team rehearsing them so that you're prepared when they come up with the patient is going to be critical. I'll go into more detail on how to handle some of these most common objections so that we can give it more time, but just make a list of those in your practice and you'll find that it's not that many, and you probably already have pretty decent responses when they do come up. My call to action is that in a dental office, your ability to stop and think about how you communicate and how you build rapport and connect with patients is going to cost you probably the least amount of money and time and provide you one of the biggest ROIs in your case acceptance and your new patient experience, because again, most people won't remember what you did or what you said, but they will remember how you made them feel. If you haven't rehearsed that before, it's time to do it now. If you want to get more videos like this and hear more stories about how we implement communication skills in our practice, stay tuned. We have a whole channel built towards those topics specifically. Thank you.